Hello and welcome to another segment of Western Wisconsin Journal. I'm Jamie Johnson, the political and government correspondent, and it feels like spring today. We're getting closer. It's early March. Coming up on April 2nd is spring elections. We have three guests here to talk about something on the ballot. It is a county referendum. And so to my right is Ken Witt, and we have the Sheriff Knudson and Bob Rohret, who is head of Department of Human Services. I'm sorry I didn't mention St. Croix County Sheriff's Department. It's kind of a given with the uniform you got. Yes. We'll start, I guess, with you, Ken. We've got a referendum on the spring ballot. It's called a Public Safety Referendum. And why does it have that title? We'll start with that. And
Sure.
Why is it on the ballot?
Yeah, well, we're looking for additional positions within our public safety departments. So we're looking for 8 different positions. There's 2 mental health co-responders, 2 corrections deputies, 1 sheriff's office investigator, a district attorney's investigator, a youth justice early intervention specialist, and a deputy clerk of court. So it kind of spans multiple departments, but they're all working towards the same public safety missions.
Somewhere along that spectrum of law enforcement and then the follow-up with the crime processing and so forth. So, all right. Now, how is this referendum different than the public safety referendum of 2023?
Yeah, well, in 2023, we sat down and we analyzed the whole public safety system and determined what we needed and identified 24 positions. And so that's what we went to the voters with. So that wasn't approved. I think we were actually probably very fortunate. The state of Wisconsin came through with additional funding resources last year. So we were able to fund 13 of those positions through that additional state funding that we received.
So this year, 8 positions, last time 24.
Yep.
But 13, you
Yep.
said?
Yeah, so 13, so there was 11 left. So we took a closer look at it, sharpened it down to 8 positions, $896,000. So hopefully it's more palatable dollar amount for the voters. And it really does, though, go to the core needs of our public safety in order to cover all aspects of the system.
Okay, and tell me again, this $900,000, because I know it crosses several departments, so it's not just, but if we had the overall budget of the county, what does this represent an increase of?
It was very small. I mean, the county's budget is $125 million, so I mean, it's less than 1% of the
Less
whole
than
county
1%.
budget.
All right. Thank you for giving that perspective.
Yep.
So I'll turn to Sheriff and Bob here, but what specific issues or challenges is the county facing currently and recently with regard to public safety, and how will that additional funding address those issues? And I'll let either one of you go first.
Well, for us with the jail, and last year we were trying to get more patrol positions, and we kind of talked about that as well. But as society is changing, we're seeing more mental health, substance abuse issues, and complexity of crimes.
Okay.
With the advent of technology, many of our crimes are media-driven, and the amount of time it takes for search warrants to work through and gather good cases, put good cases together for prosecution, it's taking up much more time. So,
And I heard in the sheriff's answer there the terms addiction and mental health, and that's an area that certainly your department spends a lot of time on, right?
Yes, it is. And as the sheriff said, a lot of these calls that he and other law enforcement have to respond to are related to mental health and crisis related to addiction. And it's very time consuming for them. It's another thing that the sheriff's office and other law enforcement are being asked to do in responding to these kinds of events. So the challenge really is, how do you respond to crisis events in a compassionate way while freeing up law enforcement to do other things that they need to do. And that's one of the challenges that I know Sheriff Knudson has mentioned has been a real problem, and other police departments.
Well, one of the things over the years I've heard is, when it comes to law enforcement, prevention is worth a pound of cure. You talked about the jails and how expensive that is on that end, but if we can have people who are properly trained on the end that deal with the addiction and the mental health before the crime is being committed, that will end up saving taxpayers in the long run.
Significantly, yes. Placement in a hospital setting can be as much as $1,400 a day. And if we can prevent someone from going to a hospital, we save that money, but we also provide them with a more appropriate level of intervention in that moment to hopefully keep them in their homes and keep them in their home community safely.
Okay. Getting back to the sheriff's corrections deputies and the jail and this investigator that's being proposed, how do those specific roles, how are they not being covered now, or how will these new positions help in that regard?
When we talk about the jail, and Bob had it right on, least restrictive areas when we go out to do these mental health evaluations, and at home, keeping them at home is the preferred, if we
Right.
can do it. There are times, though, when that mental health is coupled with a crime, and then they end up in jail for public safety reasons,
Right.
but the mental health is still there. So as we're housing them within the jail, it's taking more staff resources. There's more attention to detail, and they're housing specific areas. In 2020, we added 9 special needs cells
Okay.
in the area that was the gym, and that was remodeled into these special needs. So in essence, it added another wing, so to speak, for attention to be tended to by the jail staff. But the jail staff did not increase.
Okay.
So it kind of spread us out a little bit more with classification issues, and really medications, and in those special needs cells are for those with mental health, but also those substance abuse that are coming down, that are trying to detox. So it's very labor intensive, and we need to make sure that they're safe in those cells. So it's really a lot of watching and observing, getting the nurses to see them. I went through the February statistics, and just last month alone, we had 233 individuals that were booked into the jail.
Okay.
Population was, towards the end of the month, at 140. It fluctuated from 114 to 140, so we're getting back up to that number that in 2019 we were above 150. Now we're back up hitting 140. But the special needs cells, during the month we had 8 inmates on active or 15-minute suicide watches. That was a total of 19 days. There were 5 inmates on 30-minute medical or mental health watches for a total of 9 days. And then there was 8 inmates on 60-minute medical mental health watches for a total of 36 days. So very labor intensive. And
Yeah, these are
certain areas.
These are special checks that have to be performed,
Yes.
and it takes up man hours
Yep.
to use that, to get that
You know,
done.
when I go through 8 inmates and 16, but we had 140. So there's still all the other ones to address and make sure that they're taken care of as well.
And so then, and that also stretches the deputies in terms of getting the training too.
Yes.
When they have to start performing functions that maybe specialists would otherwise come in and be doing.
Absolutely.
So, how about complexity of crimes? How has that changed in St. Croix County? I don't know, how many years now have you been sheriff?
I've been sheriff since 2017.
Okay,
Been with the sheriff's office since the end of '95.
right. And I knew that we go back a long ways. I've known you a
do.
long time, so that's almost 30 years. That there's a lot of changes in crime in that time period. And so how does that impacting your department and law enforcement in general?
Yeah, we have had to change over the years so much from even when I started. We didn't have computers. Those crimes really didn't exist. Cell phones and the amount of information on a cell phone now. And really that is the crux of a lot of our nexus of crimes right now. Our burglaries, we were just recognized last year by the Wisconsin Department of Justice as an ICAC affiliate, Internet Crimes Against Children affiliate for
Okay.
the DOJ. And those take a lot of time and a lot of technology to dig through. So And the amount of, and Bob may talk about this, Child Protective Service referrals. Now more than ever, we are following up on a lot of these child protective crimes and the complexity of that training, as well as the need for more investigators to do that.
Yeah, you know, with technology and prevalence of computers, that's where there's a lot of new crimes that are on the books that weren't even around 20 years ago.
We never thought of them.
Yeah. So you mentioned the jail. Anything more you wanted to add as far as the jail they're facing? You know, you mentioned the correction deputies and their extra roles they serve, but any other challenges there at the jail?
You know, it's really housing as well. You know, we have classification issues, and now there's so many different classifications, which is also spreading inmates throughout the facility, where we've repurposed one or two of the Huber dorms, because Huber is not, and that Huber is work release. So we've utilized some of those dorms for general population. So because of classification, it's kind of spread out the facility more as well. So again, it's getting enough staff to cover all these locations.
And these are recent developments in those changes.
The Huber has really changed since COVID.
Yes.
We had to rethink housing, people going to and from work every day during COVID, where now we push people out more on electronic home monitoring. That seems to be a change that might stick for a bit. So that opened up some
Again,
doors.
that least restrictive environment.
The least
right?
restrictive environment, yes.
All right. So now let's switch back to Bob. Can you describe, you know, the role and the impact of mental health co-responders in St. Croix County since their introduction?
Sure. So as we talked about already, the idea of upstream or early intervention in crisis events is important for the well-being of the person, as well as the cost savings that go on to taxpayers. But the impact that we've had in the last 2 or so years in having these positions available has resulted in nearly 300 calls that they've gone out on with law enforcement. And that's law enforcement agencies across the county, the sheriff certainly, but sheriff's department, but also all of the local law enforcement agencies that we have agreements with. So they've gone out on nearly 300 calls with law enforcement, and in this partnership with law enforcement have helped to develop primarily safety plans with people that help them stay safe in the short term while they get connected with ongoing care. And that's been a tremendous benefit in terms of allowing people to remain in their homes, in their communities, and not have their lives disrupted by sending them to a hospital or possibly in being incarcerated. So we prevent a lot of those deep end costs, a lot of those deep end and sometimes poor outcomes by addressing the needs of the person in the moment in partnership with law enforcement.
All right. This, yeah, just the name would suggest co-responders, so they're responding with law enforcement. But how? Maybe it's with an example that you could give how it becomes actually more efficient and better for all concerned to have 2 people responding rather than, say, just a deputy who's got more law enforcement training than mental health counseling training.
So the officer might call and request a co-responder arrive at the situation or the crisis event. At that time, the co-responder, the law enforcement officer, and the person in crisis would have a discussion about what might resolve that issue for them in that moment. Once the officer and the co-responder are both comfortable with the safety plan or the outcome, that whatever they decide on, law enforcement's free to leave the scene and go on to other calls while the co-responder stays behind and continues to work with that individual as long as they need to.
Thank you. That helps explain it. You know, I used to be a prosecutor. My brother-in-law was a police officer. Went on some ride-alongs with him. But you do encounter situations where it would be tough to find a technical violation of the law, and if it's just a law enforcement officer on their own, they really can't do much other than arrest the person, right?
Correct. You know, and as Bob said, it's freeing up an officer's time. You know, he talked about almost 300 times. Today alone, we have 2 deputies driving one to Winnebago and another deputy driving one to Amory. Those are our only options right now with, the
Right.
closure coming in Chippewa or down in Eau Claire. Our resources are now getting even more limited to
Right.
take people. And I think now it's
So
why
if
these
the officer
covers-
doesn't have to stick around trying to resolve a situation, that's somebody that is more
Yes.
trained. But it's a great advantage, I can see that. So
Yes.
you gave examples of how the co-responder has positively impacted members of the community. Is it usually in a situation of self-harm, or what is that way that a police officer would then leave and
That's a good example of what might be the situation. And if, again, it's a partnership between law enforcement and the mental health co-responder. So if they come to agreement that that person, to use that example, might be suicidal or say suicidal things that would create concern, if law enforcement and the co-responder both agree that here's a way to keep this person safe in the short term, then certainly that would be a situation where law enforcement could leave. And the co-responder then would not only work with that person as long as needed, but they would connect them with ongoing care after the event, if they were agreeable to that. So there's an ongoing component to this that would continue to support people beyond the crisis event.
There's already been at least one mention of COVID, because it's a landmark situation with how things have changed in almost everyone's way of life or their day jobs, so to speak. But the impact of ARPA and funding, was in response to COVID. So with that funding expiring, what will be the impact on mental health crisis intervention if this referendum were not to pass?
Yeah. Well, as the sheriff mentioned, with the closure of the hospital in Eau Claire, it further diminishes our resources available in western Wisconsin. If the funding isn't approved for these co-responder positions once ARPA funding sunsets, we're very limited, or possibly won't be able to fund these positions going forward. It depends on if there's a funding stream that comes online at some point that would sustain them, then we could maybe expand upon this idea or continue to fund the current positions, but it doesn't seem likely at this point.
Yeah, sometimes in the short term, the ARPA funding helped in lots of ways, but it's very hard to establish long-term programs based on temporary funding.
Even with the good outcomes that we're seeing, yes.
So then, Ken, back to you. How will the proposed tax levy impact the average homeowner? You mentioned this is a very small fraction of a budgetary increase, but what in terms of
Sure.
dollar for an average homeowner?
Yeah, we can calculate that. So just using very round numbers, $100,000 in value would see about a $5 increase. So if $300,000, kind of a median home value in St. Croix County, overall, that's $15 per year. And really, when you think about the bigger picture of the county taxes, St. Croix County tax rate has come down to its lowest level in 50 years. So the county board has been very diligent about keeping taxes low, and levy limits within the state of Wisconsin have helped drive that down also. And this is the tool, though, that the state legislature provided for these exact scenarios when we need to increase beyond what our levy limit capacities have, is to ask the voter for that. So for that extra $15 per average household, that's kind of what we're looking for.
We talked about the budget, and I know, we've had you on before talking about where the county gets its funding and sales tax and so forth. But why wouldn't we put these 8 positions, say, in terms of the sales tax, or something that fluctuates from year to year? Why would that be an adverse situation as opposed to this levy increase?
So when you add up all the revenues of the county and you add up all the expenses, all the dollars are already accounted for.
Right.
And so the sales tax goes up from year to year, but so does our inflationary pressures on everything else that we have. Health insurance alone is 10% of the county's budget.
Payroll has to go up. So,
Yeah. Well, I mean, even, payroll, you can stop increasing that. Health insurance, you really can't. Health insurance is going to increase.
Yeah.
The amount of, the cost of asphalt to continue to pave and repairs of the streets, that goes up every single year, and we can't stop those inflationary measures. Okay. So those inflationary measures are going to go up, and that's eating up the new revenues that we're seeing every year. So in order to grow beyond our base, we really either have to have new revenue sources, which we were fortunate to get from the state last year, or we have to go to the taxpayers and ask for the mechanism that was provided by the legislature to provide for the increase.
But again, getting back to this, you know, $15 for $300,000, $25 for $500,000. You're talking about $15 to $25 on an annual basis. If you live in a neighborhood like I do with about 23 other homes, you know, you're talking a very small investment in terms of even if one of those houses has one of these crises happening.
Sure. Yeah, you know, if you had that individual crisis in your household, the dollar amount for the service that you get is minuscule.
Right.
Yeah, but it's a shared cost around the whole county because you never know when you'll need that service.
Right, right.
But it's good to have
But
available.
this is all under the rubric of public safety, which is, I think everyone can agree, is one of the basic functions that government needs to provide. So I can throw it out to all of you. What would a no vote again? Now we know that the last one, which was 23 positions, so it was more dollars being considered. That one got voted down. Now this is about a third of the number of positions being sought. But what impact would that no vote have even on this smaller referendum? I'll let any of you jump in.
Yeah. I can start with the dollar impact. So what it means is that the county then has to prioritize. And so they have to make those hard choices then about what's going to increase and what's not going to increase. These two current positions, these mental health co-responders, are something that will be cut from the budget unless we can find something else to cover them.
So it's not like you just find another pot of money to find.
Yeah, there won't be, you know, a big influx of new revenues from the state this year. That was kind of a one-time thing, and we took advantage of it, and we really beefed up the Sheriff's Department's patrol division with that. But there won't be another one like that this next year.
Okay. And then on your guys' side, what would you say?
Go ahead.
Well, the trends that we're seeing are an increase in mental health and addiction-related crisis, just generally, across the county, across the state. That combined with a continual, either a stagnant set of resources or a diminishing set of resources with, again, the hospital closing in Eau Claire, puts a lot of pressure on not just our department, but on our availability and ability to provide these kinds of services to our residents. It's another thing that would be removed from the equation in terms of helping people in our community that we think is beneficial, efficient, and saves taxpayers' dollars.
Okay. Anything more to add to that, Sheriff?
You know, it'll be, for me, it'll be a domino effect. You know, we are looking for the sheriff's office for 2 jail staff and 1 investigator. But if we lose these co-responders, that's going to impact our patrol.
Right.
Again, taking more resources there.
So those gains that you saw from that extra state money, that is going to be diminished.
Absolutely. And if we can't come up with safety plans at home, and for whatever reason there's some form of a crime and it's going to come into the jail, that's more for the jail staff to have to manage when it comes to mental health and those in crisis. And many times that's not the best place for them. So it's going to have a domino effect with the co-responders into the jail. And as far as the investigator, because of the complexity and the more time it's taking for our investigative unit, you know, and we still have a drug problem, we still have a meth problem, fentanyl's out there. So spread out kind of thin, then we'd have to start prioritizing, you know, the most significant crimes and the ones that maybe property crimes, damage of properties, some thefts. When we would have time, we would get to them, and people would see that impact as well.
Yeah, you mentioned the theft thing, and we talked about the complexity of crime. The days of a lot of the theft happening in person is not occurring. A lot of the theft is online, which again requires a lot of investigative
Online,
work.
the scams, the elderly
Right.
scams that are taking place, financial. So yeah, it's
You see a domino effect.
a great domino effect.
All right, Ken, so if approved though, let's look at the bright side. What would this tax levy increase, when would it go into effect?
Yeah, it doesn't go into effect until 2025. So the April election is right at the beginning of our budget cycle. So we'll know then, planning for 2025, that we'll have those resources available.
And I mean, I don't know, when do your departments start submitting preliminary budgets, and when you get those numbers? That process starts pretty early.
Ken has a stir in the pot now.
Okay. And you want those generally approved by November meeting? Is that when you do the budget?
Yeah, you know, that's a final approval. By
Okay.
then, there's been months and months of work and a lot of labor hours that have gone into the preparation. It's probably more like July that most of the budget is really prepared.
Well, you're lucky that you're not a school district, because we have our budget year starts in July and we don't get our budget approved till October. So we're already 3 months into it. So I like that you're proactive in that regard. So where can our viewers learn more about this referendum that's coming up here now in about a little over 3 weeks?
Yeah, we have a really good website, a page dedicated towards it. So sccwi.gov/referendum. All the information you could possibly want to know is on there.
Or Google St. Croix County referendum, it should
Yep.
come up.
If you
Yeah.
find our website, you'll find the information.
Excellent, great. Well, I want to thank you, gentlemen, for being on the show, and thank you for your work and keeping our public safe and here in St. Croix County. And I guess good luck on April 2nd. Hopefully, my viewers out there, if you want to learn more, go to the website as Ken discussed, and make sure that you get out there and vote on April 2nd. Thank you for watching. I'm Jamie Johnson.